This tutorial covers how to submit 2023 data in our online data portal to receive a 2024 Achievement Award for the American Heart Association and American Medical Association's initiative, Target BP. Log into the data platform at aha.infosarioregistry.com/login using the username and password sent to you via email after registering. Pause here to review further details on screen now regarding how to register your organization and get a user account. You will submit data through Program Forms. Click either the icon under Get Started or the link in the left navigation bar. If your organization has submitted in the past, you may have existing forms under the Edit Form section, like I do here. Each year represents the calendar year from which that data was collected. This video focuses on 2024 recognition. For this, you'll need to submit a 2023 form. If you or another member of your organization have already started entering your 2023 data for recognition, you'll see it under Edit Forms and can click on it at any time to continue entering data. I don't have a 2023 form yet, so I'm going to click Add New next to Target BP and then type 2023 into the reporting year field. Hit Submit to start the form. Target BP has 3 tabs of data to enter, which you can see under tabs on the right. All fields must be completed to be eligible for an award. The first tab, Facility Information, contains questions about your healthcare organization and includes the measure denominator and numerator questions that will determine your recognition status. It also includes 2 questions asking you to break down your total adult population, one by race and ethnicity using the HRSA UDS reporting requirements for 2023 health center data, and then 2 by payer group. The gray boxes cannot be edited. They auto-populate as guides to determine if your numbers are matching up. The second and third tabs ask the submitter to attest if the organization has completed specific evidence-based blood pressure activities by the end of 2023. These questions are broken out into 5 pillars: measure accurately, act rapidly, partner with patients, and then on tab 3, self-measured blood pressure, and equitable health outcomes. Eligibility for Silver and Gold Plus awards depend on the responses given in the Measure Accurately pillar on tab 2. The other 4 pillars are included as a dry run and will not impact awards in 2024. You can save or save and exit and come back at any time to revise your data. However, once all fields are complete and no errors are detected, go back to the Facility Information tab where the Data Entry Complete checkbox becomes available. Check this box, then save to complete your submission. A snapshot of all data in the platform, complete or incomplete, is taken at the date and time of the recognition deadline, but you can revise your data at any point up until this snapshot time. Let's start entering our data. Before you begin, make sure the data you submit is representative of the healthcare organization you're currently viewing. Look left under Currently Viewing or at the top right to orient yourself. I recommend having the data collection worksheet available or filling it out ahead of time for ease. You can navigate directly to the data collection worksheet through this link in the instructions. I'm right-clicking to open it in a new tab. Click Download PDF to open it. Questions may change from year to year, so please ensure that you have the latest data collection worksheet. The worksheet contains additional guidance on how to answer each question, especially for question 9, which asks for a patient breakdown by their primary payer. Scroll to the last page to see detailed guidance. Let's go back to the data platform. You can also use the official MIPS 236 measure specifications, which can be opened directly from the program form by clicking Measure Description link controlling high blood pressure. I've opened it in a new tab, so I can have it available when needed. The first question asks if your organization diagnoses and manages patients with hypertension, up to and including prescribing medications. A yes response is required to be eligible for a 2024 award. The second question requires you to certify that the attestations entered in the form are accurate to the best of your knowledge. A yes response is also required here to be eligible for a 2024 award. Question 3 asks for the total adult patient population ages 18 years and older. We are looking for your outpatient population who had a visit in office or via telehealth in 2023 for your organization and who were seen by providers who diagnose and treat hypertension. Please exclude acute care visits from this total. When pulling data for this question, make sure that you are saving this query and can further break down the patients included by category. Later questions ask you to break down this patient total by primary payer and race and ethnicity, and these breakdowns must add up to your question 3 total. My demo organization has 38,248 patients ages 18 years and older. Question 4 is the denominator of the controlling high blood pressure measure. Using MIPS 236 measure logic, of the patients ages 18 to 85 who had an encounter in 2023, how many had a diagnosis of essential hypertension starting before and continuing into, or starting during, the first 6 months of the measurement period of January 1st through December 31st, 2023. Make sure to exclude certain patients based on the measure requirements, such as those with end-stage renal disease. My demo facility had 19,824 patients who met this criteria. Question 5 is the numerator of the measure. Of the hypertensive patients already included in question 4, how many of them had their blood pressure under control at their most recent 2023 visit? Under control is considered a systolic blood pressure of less than 140 millimeters of mercury and a diastolic blood pressure less than 90 millimeters of mercury. I had 14,270 hypertensive patients whose blood pressure was under 140/90 in 2023. Questions 4 and 5 are used to calculate your organization's performance on the measure. For question 6, we are looking for context on your numerator data. Blood pressure readings from remote monitoring devices can be included in the numerator as long as they meet criteria specified in the data collection worksheet. We are interested in understanding if your organization's data includes remote blood pressure readings. Any answer is okay and will not affect your award level. For question 7, input how many providers your healthcare organization has. We are looking for all physicians, nurse practitioners, and physician assistants involved in diagnosing and treating hypertension in your outpatient organization. In question 8, we ask for a breakdown of how your total adult patient population, ages 18 years and older, self-identify by race and ethnicity. This question is based on Table 3B of the HRSA Uniform Data System reporting requirements for 2023 Health Center data. All fields must contain a value. Please enter a 0 where there are no patients. Here is the data that I have. The final 3 fields are inclusive of all patients who have either their race, ethnicity, or both unknown or undisclosed. If they have identified as Hispanic, Latino, Latina, or of Spanish origin, but not disclosed their race, place them in the first of these 3 final fields. If they have identified their race, but not their ethnicity, place them here. And then finally, if you know neither their race nor their ethnicity, place them in the final field. Once all the fields are filled in, an automatic total of what you have entered populates in the gray box at the bottom. This box must equal your answer to question 3. For question 9, take your total adult patient population given in question 3 and break it down by the patient's primary payer. Not sure which groups your patients fall under? Use the guidance in the data collection worksheet. The last page gives guidance on payer groupings. Here's the data that I have. If you're still not sure on some patients' payer groups, put them under the Other Unknown category. Like in question 8, once all the fields are filled in, an automatic total of what you have entered populates in the gray box at the bottom, which must equal your answer to question 3. If it does not, say if I change my other patients from 138 to a 0, an error will appear at question 3. Because this is a red error, I won't be able to save my form. For red errors like this one, I can delete one of the fields that's contributing to my subtotal to make the error disappear, allowing me to save and come back later. That said, all fields must be completed to be eligible for an award, so in order to fully fix this, I must eventually fill in this blank so these totals align. Next up is the second tab, which we can find by either clicking the Next button at the bottom or the tabs icon at the right. This tab features questions on our Measure Accurately, Act Rapidly, and Partner with Patients pillars. Questions 10 through 15 are returning questions about your organization's blood pressure measurement practices. Questions tied to 6 activities. 1. Regular calibration of all blood pressure devices. 2. Reviewing a list of validated blood pressure devices. 3. Staff training. 4. Staff skills checks. 5. Protocols to obtain accurate blood pressure measurements. And 6. Posting visual reminders of correct blood pressure measurement procedures. To receive our regular Gold Award or Participant Award, you will still need to answer all questions. Note that the Participant Award is only available to first-time data submitters. If you're unsure of the answers, please respond with "not sure." Here are some tips. In the same way that we're looking for 2023 data, we are looking for 2023 practices. Recurring activities such as staff training must have occurred at least once in 2023 to answer yes. One-time activities such as placing a positioning graphic next to all blood pressure device stations could have occurred before 2023 but needs to have been continued in 2023. Each unique question number corresponds to one of the 6 activities. Questions 10A and 10B together represent one activity, while question 11 alone represents one activity. For Silver and Gold Plus awards, you must have achieved at least 4 of 6 of the M activities. Question 10 represents only one activity, device calibration, but is split into 2 parts for aneroid and oscillometric devices. To achieve this activity, your answers must show that you calibrate all devices you regularly use. If you have both aneroid and oscillometric devices, you must calibrate both types to achieve this activity. If you only have one type of device, you must calibrate that type and select no devices for the other type to achieve this activity. My organization has both device types, and we currently only calibrate the aneroid devices on the recommended timeline. I'll answer yes for question 10A and no for question 10B. Because we have both device types but are not calibrating both devices, we have not achieved this activity. Question 11 asks you to review validatebp.org or a similar source of validated blood pressure devices. These devices have been independently validated for clinical accuracy. If your organization uses oscillometric devices, select the percentage that are found on this list. If your organization does not use oscillometric devices, you'll note that the platform automatically chooses 0% for question 11. This still qualifies as completion of one activity for Silver or Gold Plus eligibility. After briefly comparing validatebp.org and my organization's inventory of oscillometric devices, I'm approximating about 15% of our automated devices are validated, so I've selected the approximate range of 11 to 20% in the dropdown. Note, everyone should be able to achieve the question 11 activity. As long as you review an online listing and select any percent in this field, you will receive credit for this activity. However, if you answer not sure, this will not count as one activity. So please do your best to review a list and estimate how many of your devices are validated. A 0% answer is acceptable. Complete questions 12 through 15 to the best of your knowledge. A yes response on any of these equals achieving the activity. Please use the data collection worksheet for details and additional resources. These responses will be used to determine eligibility for Silver and Gold Plus awards, so it's best to consult an individual familiar with these practices before answering. Please be honest in your responses. The next section is our Act Rapidly pillar, questions 16 through 21. We ask you to attest if your organization uses a practice-wide hypertension protocol, including, at a minimum, formal approval and systematic implementation into clinical practice, monitoring to assess the use of the protocol in question, a blood pressure treatment goal of less than 130/80 millimeters of mercury for adults with confirmed hypertension and known CVD or 10-year ASCVD event risk of 10% or higher, prompts for clinicians or prescribers to intensify treatment, strategies designed to improve patient adherence, and follow-up contact with patients who have not yet reached their hypertension treatment goal. I'll answer for my demo organization now. Note, in question 18, stating this individual patient treatment goal of less than 130/80 in a protocol is different from the overall patient population performance measure of less than 140/90 used in question 5. Each question in the Act Rapidly pillar and upcoming pillars are asked in a yes, no, or not sure format. Remember, these questions are being included as a dry run, and answers are required but will not impact your award. The last section on the second tab is our Partnering with Patients pillar, questions 22 through 27. We will ask if your organization provides risk factor assessment and non-pharmacological interventions for patients with hypertension to support positive lifestyle changes that includes a systematic policy and/or procedure for the assessment of risk factors and use of non-pharmacological interventions, monitoring to assess the use of the policy in practice, assessment of nutrition, sodium, and potassium intake, physical activity, weight, and body mass index, assessment of alcohol consumption and tobacco, intervention to improve nutrition, reduce sodium intake, increase potassium intake, increase physical activity, reduce weight, and reduce body mass index as indicated, and intervention to address alcohol moderation and tobacco cessation. I'll select my answers now. Next up is the third tab, which we can find by clicking either the Tabs button at the top of the screen or the Next button below. Make sure that you save your work frequently. Now we can complete the third and final tab, which includes questions on our final two pillars. The Self-Measured Blood Pressure pillar, or SMBP pillar, includes questions 28 through 33. These ask if your organization uses SMBP to confirm a diagnosis, guide treatment intensification, or support longer-term lifestyle change and/or medication adherence for hypertension. If so, we ask if your SMBP program includes, at a minimum, systematic, policy and/or procedure defining the steps to prepare patients for SMBP monitoring, monitoring to assess the use of the policy in question, assessment to ensure the appropriate blood pressure cuff size for the patient, and education to prepare patients to use SMBP, approach to establishing a measurement schedule, receipt of readings from the patient via any means, and review and averaging of a minimum number of 12 SMBP readings from a month of home monitoring to help inform diagnostic and treatment decisions, and ensuring that a minimum of 30 patients or 10% of your patient population with hypertension per year, whichever number is larger, utilize SMBP monitoring as described above. Here are my answers. Our final pillar is equitable health outcomes, questions 34 through 39. Here, we ask you to attest that your organization collects and uses patient population data to assess for equitable healthcare improvements and outcomes in blood pressure control that include adoption of a policy and procedure to systematically gather race and ethnicity data, adoption of a policy and procedure to systematically assess social determinants of health, monitoring of team adherence to those policies and procedures, training our team to gather the data per those policies, stratification of control rate data by two subgroups at risk for inequitable health outcomes, such as patients from racial or ethnic groups, without insurance, by zip code, or by social determinant of health elements, and examination and use of data for care or quality improvement opportunities and taking action to address gaps in outcomes across groups. Here are my answers. Remember, the new pillar questions will not affect awards in 2024. For more detailed information on each question, please watch our Target BP Evolution webinar and review our Target BP Program Evolution Overview document that can be found on targetbp.org. Once we have completed all of our questions, we will navigate back to the Facility Information tab on the right. The last step in our submission process is to check the Data Entry Complete box. An important note, if this checkbox cannot be populated, it means your data is incomplete and you may not be eligible for recognition. Please review all three tabs and ensure no fields are left unanswered before exiting. I am unable to check the box. Scrolling through my questions, I can see this is because I left the other unknown field for question 9 blank. Now that it is corrected, I should be able to check the Data Entry Complete box, which ensures that I am ready for recognition. Finally, I'll click Save and Exit. Back under Program Forms, I now have a Save 2023 form for Target BP. You can go back and edit your data at any time before the data submission deadline. As long as your data is complete by that time, you are considered eligible for an Achievement Award. Look out for regular newsletters and additional communications from the American Heart Association to learn more about our quality improvement initiatives and Achievement Award. Thank you for choosing to submit data for Target BP. If you have additional questions, please contact us at bit.ly/aqcontactus. Or if you need help logging in, you can contact our platform vendor using the email address on screen now.